Hello and welcome back to the Hormone Genius podcast. Jamie and I are here for part two of menopause hormone replacement therapy. I'm pumped to be back talking about this, Jamie. I think already we've gotten really great feedback from part one and
Mhm.
how people are really interested in understanding menopause and hormone therapy and all the ins and outs of it because it's not easy to manage menopause.
Mhm.
There is a huge shift in hormones with menopause. And needless to say, it's a big quality of life transition for many women that needs a lot of support. And so we're here for you, trying to answer all the questions. And as you might know, I'm a women's health nurse practitioner with clinical experience managing menopause for many years. And I just want to take the time to basically give you at least some sense of how this can all work for you. Now, please remember, this is not for medical information because we know you need to talk to your individual healthcare professional about your unique needs. So we're offering basically an educational kind of experience, but knowing that you need to go to your healthcare professional to really talk about these and whether, any hormone therapy is safe for you and whatnot. But Jamie, the last time when we finished up, I got to the end and I said I really wanted to talk about, the nature of hormone therapy and what kind of things you have to manage that can come up as maybe side effects. And one of the biggest ones is bleeding after starting menopause hormone therapy, in particular after starting usually an estradiol and progesterone regimen. We realize that if you have a hysterectomy, you don't need to bleed anymore, right? Or you're not going to bleed. So this is going to be more in relationship to those who have their uterus still and are trying to understand if they're going to take estrogen and progesterone and they start spotting, what are the next steps at that point? So Jamie, is that something you've ever had a patient or a client, I should say, kind of talk about, or is that something that ever gets brought up with friends or whatnot?
You know, I would say most of the clients we work with are still cycling. Not to say that we wouldn't work with a woman in menopause. I've heard of women in menopause spotting, and I've always even wondered, in terms of as a byproduct or what have you of hormone replacement therapy. But I've always kind of wondered too, okay, interesting. Because I know that when we're cycling, there's reasons we bleed, and there could be a reason of bleeding that we aren't because we're not pregnant. So then the hormones that we're kind of preparing for a baby now are dropping off. So anytime I think about bleeding, personally, I either think, oh, it's an infection, or I think, oh, there's been a hormone drop, that there's a little blood there because the hormones are there and now they're not. The hormones are there, now they're not. So I'm just kind of deducing that perhaps that is why there's spotting, but I could be very wrong. So I'm wondering from you, Teresa, is that the function or is that what causes some of these bleedings with HRT?
Yeah, so if we think about what causes a menstrual flow, it is the rising and the falling of hormones that stimulates this kind of shedding of the cells of the lining of the womb. Now, in menopause, there is no rising and falling
Right.
in a menstrual cycle way, as you said.
Mm-hmm.
And I think the best analogy I like to use for why you can still bleed, even though there's no menses, there's no menstrual cycle anymore, is that there needs to be always for the lining of the womb, the lining of the uterus, a delicate balance of bricks and mortar. So I like to, and I can't remember where I learned this analogy, but it's really helpful to me that the estrogen is like the bricks being laid upon the womb of your body or upon the uterus. And the progesterone is like the mortar that keeps the bricks on there. And that makes a lot of sense. So after, a menstrual cycle, you are laying these bricks and mortar to basically prepare a womb for a pregnancy.
Mm-hmm.
And if the pregnancy doesn't occur, then what happens is the body drops estrogen and progesterone and all the bricks fall. And that brings the lining back to its baseline again so that it can start the next egg to be released for the process of potential pregnancy. In menopause, when we're using estrogen, we know that there is being bricks laid. And Jamie, this is why it's essential that every menopausal woman taking estrogen who has a uterus takes progesterone. Because if you just kept laying brick upon brick upon brick, Well, eventually you have too many bricks and no mortar, and you're going to develop too thick of a lining of your uterus, and you're going to end up having bricks fall,
Hmm.
which would cause bleeding.
Right.
So you need this balance between the estrogen and the progesterone in menopause with these hormones if you have a uterus. So we keep the lining thin and behaving in the sense of not bleeding. This is just to give you a frame of reference, Jamie. When you're about to have an implantation occur with pregnancy, your womb, the lining of your womb is about 1.4 to almost up to 2 centimeters in thickness. 1.8 is probably about average. After menopause, the lining should be less than 4 millimeters, 4 millimeters or
Ooh,
less.
wow.
So it is a very big shift in terms
Mhm.
of like what that lining kind of looks like. Now, with hormone therapy, we know we're kind of build up that lining a little bit, but we don't want it to build up back up to anywhere near it was when you were cycling. And so with estrogen, again, we've talked about the transdermal route, the estradiol patch, the bioidentical estradiol patch available at every pharmacy, covered by insurance. That's probably the most common that women will use for menopause hormone replacement. And then we pair that with micronized progesterone or the generica prometrium to create that brick and mortar balance.
Mhm.
But what happens if you start to bleed?
Mhm.
And that can be for a variety of reasons. Maybe for some reason there's something physical going on in the uterus that's abnormal. The most common thing that would be a polyp in the uterus. So this is like a skin tag kind of forming in the uterus. We've talked about that, Jamie, on a previous
Mhm.
episode. And so if you keep bleeding and you're on hormone therapy, generally what has to be done is you have to do a pelvic ultrasound to make sure that there is nothing like a polyp or some other abnormality, physical abnormality of the uterine lining. Sometimes, though, you'll find nothing and everything looks normal on a pelvic ultrasound, but it's just that the balance of the bricks in the mortar or the balance of the estrogen and progesterone are not there. And therefore, it's creating some dysfunctional or shedding of those bricks out. And usually, postmenopausal bleeding, when someone's on hormone therapy, is very light. It's spotting, it's not like a period.
Mhm.
It's usually kind of a very scant amount. And I would say the women most at risk for bleeding in menopause hormone therapy are the ones that were closest to the end to the where their period stopped fully. So, for example, let's say you went into menopause at 52, you started menopause hormone therapy at 53. Because you're still close to when you were having periods, you have a higher risk of having some spotting with menopause hormone therapy. The farther away you are from your periods, the less likely that is going to occur.
Question. So this is
Yes.
all really helpful. You're laying it out really nicely. So for whatever reason, I thought that once we hit menopause, if we had had like fibroids, polyps in our childbearing years, that we wouldn't likely have those after. Am I getting polyps and fibroids? I might be putting those two in the same bucket, where maybe it's really just fibroids that are that way, and then polyps can still be prevalent even in menopause.
Right. They can be, but
Okay.
Jamie, you were right in the sense that is it more likely that you would develop those things in perimenopause or premenopausal, like a fibroid, like a polyp? Yes, more likely because you have hormones and hormones feed those things and feed the growth of them. However, there are other things that actually can feed the growth of polyps and fibroids, one in particular being insulin resistance. And we know that a significant amount of the population has insulin resistance. So if you have fibroids, most of the time they shrink in menopause. If you have a polyp, it's possible that it could go away in menopause, but it's possible it just stays there. And
Mm.
this is the important factor, Jamie. If you're on hormone therapy, you have a reason you're going to stimulate it,
Yeah. Right.
right? So you're stimulating something that was already there, and that it's going to show itself eventually, which is why all postmenopausal bleeding has to be evaluated.
Right.
So course of action, again, if someone started menopause hormone therapy and they tell me they have spotting in the first 2 months, we watch that for a while. I make adjustments. I might increase their progesterone for a while and see if that gets the bleeding to stop. And many times it does. But if it goes on for a certain amount of time, all postmenopausal bleeding has to be evaluated with first a pelvic ultrasound and potentially then a what we call an endometrial biopsy, which is an in-office biopsy, kind of like a pap smear, but it goes farther into the uterus. And that just makes sure that we aren't dealing with anything as serious as precancerous cells in the uterus or uterine cancer. And so you might find that you've been in that situation, that you had some bleeding and you had to go through those steps. Once those steps are fulfilled and we decide, yep, this is not cancer, this is nothing serious, then it's a matter of adjusting the hormones to get the balance just right so that the bleeding stops.
Hmm. I suppose that could be another pointer in that direction is if you're making these adjustments, of these hormones, but yet there's still this bleeding. Because I know that in getting trained as a fertility care practitioner myself, we always refer for unusual bleeding. Always, anytime a woman for any reason has any bleeding mid-cycle, of course, when you're in menopause, you're not cycling, but if there's any unusual bleeding, we always refer out because of that. It's possible. And what's interesting too is if you are charting, so let's say, ladies, you're listening to this podcast and you're 35, and someday you'll be 55. And because you're used to looking and charting and being observant of your biomarkers, in this case, you're observant of blood or even spotting, you'll note it and you'll make sure you say something. Whereas sometimes something as light spotting, it seems almost the less of it there is, it seems less significant. Therefore, many women are like, yeah, it's not that big of a deal. It's just some spotting in places where maybe it shouldn't be. But if you're charting, you make note of that and bring it up. And if you're not, I would just to kind of cross these things off the possibility list, and we hope it's not, especially as you're in menopause. It's so important. Um, in terms of infection, how often do you see women coming in? Because of course, now their vaginal walls are drier, maybe intercourse is
Mhm.
painful, maybe
Mhm.
there is like a higher risk of UTI and some vaginal infections and dysbiosis in the microbiome of the vagina. Like, how often do you see unusual bleeding because of an infection in women in menopause?
It definitely is a possible factor, and I wouldn't call it the number one thing that causes the
Mhm.
spotting, but definitely a factor, Jamie, because, and this is important, we talked about it, I think, in part one a little bit, but every woman that goes through menopause will develop genitourinary syndrome, which is basically a fancy term, GSM, to say that the vagina is going to lose, like you said, its health in terms of the tissue health, so it atrophies and there can be a loss of the microbiome and the moisture and a lot of good things that the vagina vulva has. And so all women should know that this is going to happen to you.
Mm-hmm.
And I was listening to a podcast this morning, which, by the way, a good person to listen to, a couple of people, and we're going to talk about testosterone therapy in a minute, is Dr. Kelly Casperson and then Dr. Mary Claire Haver. But Dr. Kelly Casperson, she's very, very much a urologist who believes in treating GSM and helping women with this and advocating for women, just like Dr. Rachel Rubin as well, another urologist, also kind of truly advocating for women like this is never something that is okay. This is never okay to let women suffer with UTIs, painful intercourse, and letting the vagina just turn into a shriveled old woman,
Yeah.
But they were joking that you could tell the age of a woman by her vagina.
Yeah.
Like literally looking
Right.
at the vulvar tissue
Mm-hmm.
and saying, well, I know how old you are basically by that. But I'm
Yeah.
telling you, all women have the opportunity to never let that happen because
Yeah.
with good menopause hormone therapy and localized treatment, even to the vagina, like estrogen vaginal cream or an estrogen vaginal tablet, and even they have a treatment with using DHEA, which DHEA is also very, very helpful to the vaginal tissue that no woman has to lose the quality of their tissue in this vulvar area of their body,
Mm-hmm.
and it prevents UTI. So back to your question, do we ever see bleeding? Yes, we do, because women get atrophied and then they have bleeding after intercourse, and then the microbiome changes where they're getting infections in the vagina. And it's much more common to actually get what we call aerobic infections. These are caused by E. coli, Enterococcus faecalis, Staph aureus, so those definitely have to be checked out too, Jamie. In
Yeah.
relationship to spotting, there's just a lot of things to kind of look at.
Yeah. And you know what, too? Tiny Health is a gut testing that we really love. We love Tiny Health. So if you're having struggles with your mood health, your mood or your immune health, yada yada. But they also do testing for the vaginal microbiome. So that would be a really interesting thing is if you're in menopause and you want to know kind
Mhm.
of like what's the state of my vaginal microbiome, they do have tests for that and you could actually check. And so it just made me think of how much of a resource and tool. And one other thing I want to say, Teresa, as you were talking, I was thinking about how praise God that we live now. There's a
Yeah.
lot of things that are hard about living now in the information age because you can access information everywhere and it can get overwhelming. But for women in menopause, I can imagine, I mean, it's still happening, but it was more prevalent, 10, 20, 30, 50 plus years ago, where women had no idea how to help themselves, what was going on, anything like that. And so praise the Lord that there is information, and that there is with information comes awareness. And like you even mentioned, there's some people that you listen to, podcasters that have likely made it part of their mission to make sure women know. And again, if
Totally.
you were looking 50 years ago, there probably weren't like these pioneers. Maybe there were. There probably were, but they weren't as well known in the area of menopause and women's health.
Yeah. I mean, it's amazing. These people that we're considering like big time experts, like they'll tell you even 8 years ago, like no one was talking about this,
Right.
and how pivotal the last 10 years have been in moving this towards a direction of goodness for women. It's incredible. And even for myself, I mean, I always kind of considered myself someone who cared about menopause, but even my knowledge of how to treat it has grown so much in the last like 8 years.
Yeah.
So it is really important for us to really advocate for women in this area. Again, this all goes back to the 2002 Women's Health Initiative. And I know we talked about it a little bit in the first episode, but that study had such an incredibly negative impact on women's health care
Mm-hmm.
because of the way the media took a headline and just ran with it. And, this whole even vaginal estrogen thing, there was a black box warning that was just taken off in November of 2025. And you can read about this at Natural Womanhood has an article on the Women's Health Initiative. So you can check out Natural Womanhood WHI study. But, they had this black box warning on all hormone therapy, including vaginal estrogen, that basically said you were probably going to get dementia.
Oh
Not
my gosh.
you were probably going to get dementia. You were probably going to have all of these things like cancer and heart attack.
Mm,
So it was very unjustified. And so finally, the FDA has removed that label, and women will get the treatment they need without fear
right.
because nobody wants any of those things. And so even if I prescribe it to them, they live in fear that I'm wrong, that
Right.
somebody's wrong, and that they're going to get those things because they did the wrong thing. So it's just very important that we advocate for women in that area.
Yeah.
But yeah, genital urinary syndrome is a big deal. So if you're out there and you're already, even if you're perimenopausal and you're having pain with intercourse, frequent urinary tract infections, you need to go talk to your healthcare professional about, the changes that occur in perimenopause to menopause, because this can be treated earlier than going just into menopause. You can treat this in perimenopause as well, the genitourinary syndrome.
Right. Well, kind of sticking with that line, but transitioning into libido and
Yes.
thinking about testosterone and just thinking about, that whole area of life that will also likely shift, just like our health and our mood and all these things. But again, the good news is our life doesn't need to be over. We're going to be in the wisdom bearing chapter. There can be so much to look forward to for women not yet in menopause or you're in menopause now. Something I'm going to do for sure. And I already have kind of started this thought of like, what am I going to learn in menopause? What kind of like certificate or instrument or where am I going? Like, I have a list of things that I'm going to look forward to because if we constantly tell ourselves this season sucks, then guess what
Yeah.
we're going to believe is that it sucks.
Yeah.
So I
Yeah.
want to try to find things that are, good. But anyway, main point about things that might suck, sex drive might very much suck. Maybe you had a healthy, thriving sex life and libido and everything was good. And now things are shifting. And now that affects, of course, marriage and communication, all this whole thing. So, Teresa, how do you see this affect the women that you work with? And then how do you help them?
Jamie, this is so big. It's so
So big.
big. It's
Mm.
so big. And I first start by like just telling women that it's not their fault. Um, we get sex drive from procreative power.
Right.
And men never lose procreative power. Women lose procreative power. Therefore, natural libido is going to change. It doesn't mean intimacy has to change, but the chemical drive, the biological drive to reproduce is not there post menopause. So we have to acknowledge that there's a truth to this that is just purely biological. And, I was listening to Dr. Kelly Casperin talk about this, about how divorce rates climb,
Mhm.
how, there's lots of struggles with relationship around this time. And I have seen this and witnessed it, and it is devastating. And it's why I went on a mission in my heart to say, what can I do to help couples during this phase of life? Because it's a difficult transition from, especially my natural fertility method users, because
Right.
they've been, waiting for this moment to not, worry about pregnancy anymore. They've been using a natural method, they've done it successfully, but there was sacrifice in that.
Right.
And they're like, woohoo, I don't have to worry about pregnancy. And then it's like, "Rah, rah."
Yeah.
And now you have no procreative power and no libido. Why does it always feel like someone pulled the rug out from under you?
Exactly. Right. Okay.
So, yeah, I mean, it's like a huge thing. And so I started to really look into, and honestly, it was a good friend of mine, in Bella, which I just came back from an awesome conference. Next year, you guys, if you're healthcare professionals, check out the Reclaim Health Summit from Bella Natural Healthcare in Denver, Colorado. Um, Dee Dee Chisholm started Bella with her daughter, Abby Sinnott. They're great people. They offer a great retreat there. But it was Dee Dee and conversations with Dee Dee about testosterone therapy that really helped me understand this area better. And so it gave me a little bit of the kind of, because I think people fear testosterone. Well, they
Right.
fear all hormones, right? But testosterone's like, what? Like, can
Yeah.
we give that to women? I mean, I
Right.
know she makes testosterone, but can we really give it to her? I mean,
Mhm.
isn't that just for men?
Right.
So I was a little nervous about it, but I've flown now with testosterone by my side with my patients for now many years. And it is a game changer for a lot of women. Not for every woman, not for everyone, but it is a game changer for a lot of women. So we can, talk about Jamie testosterone and how it
Yeah.
can be supportive to libido at this phase of life.
Yeah. Let's do it. So, a woman comes into you. She's complaining, I had a sex drive, now I don't. And of course, I'm sure there's education and all of that. And even with I do want to make a side note, something too about husbands. So if a husband knows that this is going to happen, that's good. you know. But what often happens is women don't even understand what's happening.
Right.
And of course their husband isn't gonna know.
Yeah.
So I even think like those good men out there that get frustrated, let's just say, they just need to be taught and they just need to be told and even share this episode with them because again, we don't know how to take care of what we don't understand. If we don't
And I
understand
and
our
I
wife, how do we
right. And I want to say it's not about like it's not like women can't enjoy sex anymore.
right,
It's just that there isn't this natural drive that maybe was there. So it's like
right.
it's there. The ingredients are there. They just need to be stirred in a different pot. I don't know.
That's a good analogy.
Or
That's a really good analogy.
it's just
Mhm.
it's like we gotta like make sure the ingredients are better. So it's just a change. And like you said, Jamie, I think it is really important for men to understand it, but not to make it a super negative thing, a
Right,
challenge, a good
right,
challenge to have, that this is the next phase of our relationship. And committed relationships are so beautiful because intimacy is so based in the fact that you've already been so vulnerable with somebody that you can share everything.
right.
And this is an area where I think it's just like open communication and being like, how can we solve this together as a
Mhm.
man and a woman together? Like, I think that's very, very powerful.
Yeah, definitely.
Yeah.
So with testosterone, I mean, what kind of forms do you recommend or that you often use the most that you see success? It's in
Yeah.
libido, but even maybe energy and
Oh,
motivation
yeah.
and some of these other things too.
So much more than just libido. Testosterone is so much more than that. Yeah, I mean, we've been using testosterone therapy in women for 40 years.
Mhm.
So it's not like it's new. It's just that it's not mainstream. That there is clinical data on testosterone use. They just did a study. kind of like a consensus meta-analysis study in the last couple of years saying that it sure is effective for hyposexual active hyposexual actual disorder. So like low libido, basically. And it sure is effective for that. But there's not like, of course, super long-term studies on it. It is thought that it actually is it's safe in the uterine lining. It doesn't cause bleeding. It seems to be protective of breast cancer, although no one will claim for sure we know that for sure. It seems to be cardiometabolic protective. So there's a lot, and it also is bone mineral density producing.
Mm,
So many benefits to testosterone. So first of all, I test
yeah.
testosterone levels free and total. We don't just give it to women without knowing what their levels are.
Right.
And then what I do is if a testosterone level is low and the patient is like, yes, I have low libido. I can't keep my muscle mass. I'm achy and feel like my joints hurt all the time. My mood is really irritable. There's a lot of low testosterone symptoms. My motivation is low. We look at the level and we talk about treatment options. And unfortunately, there are no FDA treatment options in the pharmacy. Like you can't go to any pharmacy and find testosterone therapy for women.
Mm.
There are over a dozen therapies in there for men, even though women make 4 times as much testosterone as any other hormone. But we don't have any
Wow.
testosterone therapy options for women. Therefore, we have to be creative. And unfortunately, being creative then and trying to follow like FDA guidelines seems ridiculous because, you and I don't do this, but some of the like Dr. Kelly and Dr. Hara Claver use this as like androgel, which is a gel for men. They just have women use 1/10 of that as a transdermal on the skin option. My preference is to compound. So transdermal is a really great way to use testosterone therapy. And my preference is to compound it with a trusted compounding pharmacy because then I know I'm getting exact specific doses and I know
Right.
exactly how much is going into a woman. And again, we're looking at like 1/10 usually of what a man would actually take. But, dosing can vary uniquely between individuals and their levels, and we follow up with levels afterwards to make sure people are, kind of maintaining safety in terms of that. But we also look at how they feel because it should make you feel better.
Mm.
I also use injectable testosterone with women. Again, very safe, very effective, again, at very small doses. Here's the key with testosterone. And this will go to also, there's one more form called pellet therapy which that one gets more heavily criticized, but it also is one that we have a lot more data on in some ways. There's actually clinical data on. But what we want for women is to keep them women. Women who they want to improve all these symptoms, they're not going to want to have acne and hair growth and have their voice change.
No,
And
right.
if you're doing testosterone therapy safely, that will never happen.
Mm.
But if you are using doses that create what we call super physiologic ranges in the blood, then you have a risk of causing side effects. And I think the agreement by people who are in the hormone world, like we are, Jamie, is that we need to be careful, we need to be safe. And this is about, optimizing, and maybe you're pushing a little bit to closer to that super physiologic, but we're not trying to go crazy with it.
Right.
And so it's a little bit safer and easier to do that when you're using something like a cream, when you're using even an injection, because an injection can only last so long in the body. Once we get up to something called pellet therapy, and I know a lot of people, out there love pellet therapy, and I'm actually someone who's in the middle. I'm okay with pellet therapy, but what I think is you have to be safe and conservative with it because this is somewhere where again we have to be monitoring blood levels, monitoring patients' responses, and so this is going to be hashed out for another 10 years probably, but in 5 years I'm guessing there's going to be hopefully something on the market that actually is specific to women, testosterone therapy for women because it is incredibly valuable for motivation, energy, libido, brain health, bone muscle mass, just so many things.
Have you ever seen or heard of a woman, literally here? Have you ever heard or seen a woman who has had gotten too much testosterone in
Oh,
menopause?
100,000%. Yeah.
And isn't it where it, like if your voice deepens, you can't get it back,
There's
right?
a truth to that. Yes.
Hmm.
Yep. So I'm going to tell you a story. out
Okay.
there, people listening. I one time had a lady, she was close to 80, actually. She was in her 70s, and she looked great. I mean, she came in and she looked great. She was doing so well, and she had been on hormone therapy for years. And because of that, she was doing so great. Her skin looked great, everything. But she told me, she was like, Teresa, I'm here to see you because she said, every time I talk to my lady friends on the phone, they tell me I sound like my voice is changing. I sound like a man, like
Mm.
I'm sick, like and I noticed that in her prescriptions, she was on some transdermal hormones, and one of them was a testosterone cream. And she had been on it for a really long time.
Mm.
And nobody was monitoring her levels.
Mm.
And so I said, well, listen, I don't know. It could be something else, but I said the most logical thing for me to look at, since I'm a hormone specialist, is to check your hormone levels and see if your testosterone is in normal range. And it was like 700 something.
Oh my gosh. Oh no. Could you tell her voice was kind of low?
Yeah. Yeah,
Would
it
she have
was. It
pat?
wasn't
Okay.
like,
It
if I
wasn't
would have if I knew her before, it probably would have, but like, I mean, it didn't sound
right.
like
It wasn't
crazy to me or
terrible.
anything. It's just that
Right.
her friends who knew
No,
her
yes.
as a person before knew it was different.
Mm,
And so yeah, we just needed to adjust that. But yeah, I'm sure at that point it's probably hard to get it to change back. But I mean, we know this about it. And this is why you have to go to people who aren't in it for the money only. And I'll say that too. Do not go to these pop-up hormone clinics.
yeah.
Go to someone like me who's actually a trained medical professional, has a license. They're not just doing this on the side, and
Hmm.
do it safely and have your blood tests monitored. But
Right.
like I said, I'm a huge advocate for testosterone therapy because of the thing that we said at the beginning, Jamie, is that this is a game changer for relationship.
Hmm.
It's a game changer for feeling good in your 50s and beyond, for energy and getting out and playing pickleball still and hiking and all the things, because we know that we have testosterone deficiency in the vast majority of women who are postmenopausal. Like it's a given that these hormones are going to decline.
Right.
So if we don't treat it, just like estrogen and progesterone, we're going to have ramifications because of that.
Yeah. Oh, okay. I'm going to take a quick break and give a shout out to our podcast sponsors. Of course, We Heart Nutrition. We love them. You've been hearing us talk about We Heart Nutrition literally for years now. It's been more than a year that we've had them as our sponsor, and they're so lovely. And so if you're looking for high quality supplements, please check out weheartnutrition.com. They have a huge range from multivitamins, they have iron, they have magnesium, they have an immune system blend, they have probiotics. So please, again, it is very important that we have good, proper supplementation because the foods we eat, the soils, yada yada. So it's important. WeHeartNutrition.com, genius at checkout for 20% off of your order. Also, I want to give a shout out to Wonder Cow Colostrum. So we love Wonder Cow. They are incredible. My kids love the Wonder Cow gummies. So you might think, oh, colostrum. My kid would never, ever, ever, and ever drink that ever. I mean, besides from when they were a baby, from you. But there's no way I'm going to put that colostrum powder in my kids' water and think that they're going to drink it. But the good news is there are gummies. So I do the powder, my kids do the gummies. So go to wondercow.com and get 30% off of your first subscription with the code Hormone Genius. And then lastly, Salt and Light by Sammy. Teresa, I just ordered two more smells from them.
Wow.
Actually, one is called Eve, and then the other one is called something with grapefruit. I don't know. I just want to give it a try. But Salt and Light by Sammy, get 10% off of your order. It's a toxic-free perfume company, and you get 10% off with the code Hormone Happy. So if you need some good spring smells, scents going into the spring and summer, check them out. Okay, Teresa. So testosterone. We talked about how testosterone impacts, of course, libido, our well-being. We talked about different forms of testosterone. What would be a reason why a woman would not use testosterone? You said many women love it, some women don't.
Sure. I mean, there are
Mm.
some women that, number one, again, don't go just getting testosterone without your levels checked. There are some women who have decent testosterone levels and they don't need it.
Mm.
Um, there are also some women who just don't respond in the way that they want to respond. So maybe it just doesn't help their libido enough and they just decide it's not for them. And there's some women who shouldn't take it because they are really prone to hair growth and acne. And this isn't very common postmenopause, but there are a few postmenopausal women who still get acne, even backne.
Mm,
And if you're prone to acne, testosterone, if you think about it, it's an androgen. It can provoke acne.
mm-hmm,
So for some people, their skin won't like it. I would say that's very rare post-menopause. Pre-menopause, that's going to be more of a problem. And the hair growth thing, so I always joke, well, if you know a nursing home and women, why they go around with the Bic razor in the nursing homes on women because women become more androgen dominant without their hormones and they grow whiskers like a
mm-hmm.
man.
Yeah.
So when you add testosterone therapy, you can provoke whisker growing. And most women who are over 45 know that they're plucking a few chin hairs more, and that's just going to be amplified by testosterone therapy. It's usually never enough to be an issue. If they're liking the effect on the libido and energy and all that kind of stuff, that's not going to be a game changer for most of them. And
Yeah.
again, if you are doing this safely, keeping within physiologic ranges, you're going to be okay with those side effects. But there's no negatives that we know of on basically like again, breast cancer or any other cancers, or there's no long-term risk that we know of yet. It isn't all hashed out in the literature, but so far so good. Very little downside to testosterone therapy, very high upside to testosterone therapy, which again, we need more studies on it, of course. And Jamie, I just want to plug our perimenopause program because still this goes into so much of what you can do from a lifestyle perspective for our perimenopause into menopause in this transition. If you guys are looking for an incredible program, simple to use, do it at your own pace, a high quality and amount of content that Jamie and I put together just for you, please go to hormonegenius.com and look at perimenopause program on the banner. We think you won't regret it. That's for sure. And you can, share the information with your friends. This is about really lifestyle and so much. We talk about hormone therapy. We do cases. There's so much in it. We do weightlifting sessions. You're going to love it. And, it's great value.
I do
But
want to
Jamie,
say
is
one.
there any, yeah,
Oh yeah, I'm going to say one more thing about that, Teresa. Sometimes when you want to learn something, you go and you say, I'm going to go search a podcast. I'm going to learn about it, or I'm going to go read about it, or I'm going to do this. But I think the reason why we know the value of the perimenopause program slash course on our website, if you go to www.hormonegenius.com, you'll see it right there on the banner. Very like first thing you see, is because it's deeper and you feel kind of like you're with us. And it feels almost like you're on a journey. And it's not just one of those things where you're paying to listen to an hour of us talk like you would podcast for free. You know what I'm saying? And I want to say, Teresa and I, we provide this content for free. We've been doing this for 6 years. And so we need ways to steward our listeners. And so a way we do that is we want to provide really awesome 2.0 content for a cost. It's going to cost, but we make it so affordable for you. So again, we want to just invite you to it. Please check it out, hormonegenius.com. And Teresa, any other things? I'd say, maybe we do a part three sometime in the
yeah.
future because the course is so good with lifestyle and health and those sorts of things for sure in the perimenopause era. I would say, and correct me if I'm wrong, Teresa, in terms of menopause health, it's almost like we kind of just amplify what we learn in the perimenopause course. Those things become even more important. Like metabolic health becomes even more important. Muscle mass and trying to maintain muscle mass is even more important. Movement, community, that stuff becomes even more important. So that perimenopause is kind of like this transition phase from going from cycle bearing to wisdom bearing. And it's like, how do we learn as much as we can so that our longevity is more intact than it might have been otherwise if we didn't know this information.
Oh, 1,000%. I mean, that's it's such a beautiful summary, Jamie, of it. I mean, it's truly about longevity, I mean, when I say that, it's kind of like I don't know, it's a trigger word right now, or it's a thing, but
Hmm.
I mean, I think if we just say most of us just want to live the highest quality of life for the longest period of time
Right.
and not get the big and the bad diseases that take people quickly, you
Hmm.
know, or slowly. I mean, we just want to be here and love our families and
Right.
continue to do good work, So I think it is really about that. And I hope, Jamie, we can do a 3.0 and maybe
Yeah.
focus on again what hormone coaches,
Yeah.
Fiat Institute hormone coaches offer, menopause women and perimenopause women. What are the things that make the needle move
Hmm.
truly. And we, like we said, we think it's in this perimenopause program, but there's more in detailed stuff we can talk about. And I really want to talk about the nervous system and the limbic system because this gets so dysregulated in many
Totally.
areas of women's life, but certainly menopause has a special place for that as well.
Yeah,
And we just really want to work with women and make them feel better.
definitely. Awesome. Well, thank you so much, Teresa, for answering my questions in this Menopause 2.0. And thank you, listeners. And we hope you have an incredible day.